Good evening, everyone, and thank you very much for joining us this evening to answer whatever questions you want to pose to us tonight around the issue of COVID-19 here in North Yorkshire. So we're trying something a little different here using this technology for a public meeting. So please bear with us as we grapple this new technology. Just to confirm, your microphones and your cameras are not on, so no one can on this meeting can either see or hear you. This session is being recorded so that we can share it online afterwards. So if you wanted to ask a question during the meeting, you just need to hit on this question option, as you can see on screen there, that little icon. If you can't see it on your screen at the moment, if you hover your mouse over the screen, then an option bar should appear and you should be able to click on that question option, and then you can type your question in. Your questions will be reviewed before they're made public. So please don't put anything into the question that you don't want other people attending this session tonight to be able to see. We have asked for some questions, if anyone had any questions, if they wanted to submit them beforehand. So we'll probably just start the session with some of the questions that have been submitted online, just to get us started into the evening. So just to get moving, let me introduce you to our panel for this evening. So our first panellist this evening is Richard Webb. Richard is the Corporate Director of North Yorkshire County Council. So Richard's here to respond to any of the questions you might have around public health, care homes, hospital discharges, COVID testing in schools, school meals, technical support for pupils, support that is available for the vulnerable, or any advice around shielding.
Good evening.
Thank you, Richard. Our second panellist this evening is Amanda Bloor. So Amanda is the Accountable Officer of the North Yorkshire Clinical Commissioning Group, and Amanda can respond to your questions about vaccine options, vaccine rollout, COVID-19 transmissibility, or how the NHS is managing at present.
Good evening, everybody.
Thank you, Amanda. And finally, our third expert that we have available for to answer your questions tonight is Chief Inspector Charlotte Bloxham. Charlotte is North Yorkshire Police's Silver Commander for the forced response to COVID-19. So Charlotte's here to cover off any questions you might have about the applications of guidelines, enforcement, fixed penalty notices, breaches of the guidelines, and the North Yorkshire Police response to the pandemic. So to help set the scene for the current state of the pandemic as it affects North Yorkshire, I'm just going to invite each of our panellists to give us a brief overview of their area of responsibility, just to help give you some context for the questions that you may wish to ask. So I'll hand over first to Richard Webb.
Okay, thank you very much, Maeve, and good evening again to everyone. I'd like to start by thanking everybody right across North Yorkshire for all the huge sacrifices that everyone's making to try and really get on top of this virus, and for being so patient and resilient over what's nearly been a year now since the first cases in York, and actually 10 months since the first cases in North Yorkshire. As we stand tonight, the infection rate for North Yorkshire is at 303 per 100,000 right across the county. That's an average. 2 weeks ago, when we started the lockdown, it was 444. So you can see there has been an improvement in the situation. And across each of the districts, the range is from 228 in Scarborough to 348 in Richmondshire. However, those figures are still way too high. You may remember in September when Scarborough and Selby were put on the government's watch list, then we were talking about infection rates around 20, 30, 40 per 100,000. So we're 10 to 15 times higher than those rates, and we've got 4 more weeks of lockdown to go. So we need to crack on and crack down on this virus. We know here, as elsewhere, our hospitals and our care services are under pressure. We have 235 care settings across the county. 76 of those have at least one case, and actually 35 currently have very hot outbreaks going on. We have a lot of work obviously going on in our schools. Schools are still providing support to critical workers and to vulnerable children. We have an extensive network of community support organisations around the county, and they're helping people with some of the essentials of daily life, as well as keeping connected and providing that kind of social support that we all need. There's lots of great work jointly with our partners in the NHS and in the police, work on enforcement, work with businesses too, to keep people safe and COVID secure. So I'd like to thank everybody for all that you're doing. I'd like to thank the businesses and public service agencies and all the volunteers too. And my message for starting out tonight is, please follow the rules, wash your hands, wear a face covering, keep your distance, look out for your friends and neighbours, and crucially, stay home, protect the NHS and save lives.
Thank you, Richard. So turning then to Amanda to speak to us about the current position for the NHS.
Thank you. I'm here tonight to give you a perspective on the NHS around the current response to the pandemic in North Yorkshire. As Maeve said, my name is Amanda Bloor and I'm the Accountable Officer for North Yorkshire Clinical Commissioning Group, but I represent the wider NHS this evening and hope to give you a really good overview of the challenges we're facing and the potential and the opportunities around the vaccine programme. So firstly, just in terms of the position in our hospitals, today we see the highest number of patients with COVID in our hospitals than we've ever seen throughout the whole of this pandemic. As of yesterday, there are 471 patients in beds in our North Yorkshire and York hospitals, and that's significantly more than the 302 patients that we saw in hospital at the height of the first pandemic back in April and May last year. So the situation, as you can see, remains very serious for the NHS. Our hospitals, though, do have well-established surge plans to respond to any demand, whether that be through COVID or through normal winter pressures. And we plan very well every year for increases in activity through our hospitals. But in responding to the COVID pressures that we're seeing, the hospitals inevitably need to redeploy staff and change the way they use their spaces and those staff to respond to the needs of the patients we're seeing today. And that obviously does mean that other services need to stop and other resources are prioritised. So some more routine procedures, operations or services may be cancelled, postponed and rearranged. And that is to manage the challenge that faces our hospitals today. We've got a lot of experience so far. We've been in this pandemic now for 11 months. And what we do know is that we're expecting the rates of people in hospital, so the numbers coming in every day, to start to slow down, plateau and decrease. And we normally see that following the government guidance around lockdown, around about 7 to 10 days after the rates in the community start to stabilise and go down. There's always a time lag in terms of people needing hospitalisation. But what we are seeing is that the vaccine programme is being rolled out, but this will take time to roll out and cover all of the population. So the time to act now is now in terms of managing the infection rates. How do we reduce those infection rates and protect our NHS? So there's some clear messages that I'd like to share with you in terms of how you can help the NHS across North Yorkshire and York. Please do follow the government guidance to the letter. Only go out for essential journeys. And if you do need to go out, please wear a face covering, please maintain your distance and please wash your hands and wash your hands properly. Also, my hospital colleagues would ask me to share with you, please only go to A&E in an absolute emergency. Don't go to the hospital if you don't need to. Please, if you do need health advice at the moment, or if you think you have COVID or you're worried, ring NHS 111 or online or use the 111 app. So the other issue affecting the NHS at the moment is the pressure, the significant pressure on staff, not just in terms of our NHS, but our care service staff as well. And they've been working incredibly hard over the last 11 months, both in hospitals, in community and in primary care services. And so it's important for all of them that we all make the right choices at this moment. I'd like to just give you a bit of information about the vaccination programme, and I do think that this is the light at the end of the tunnel for us all, and I know myself and all my colleagues are really proud to be part of the vaccination programme, but we're at the very start of something that will take months to roll out across the entire population. So as you will know, there's 3 vaccinations now approved by the UK regulators: the Pfizer-BioNTech vaccine, the AstraZeneca vaccine and the Moderna vaccine. Excuse me. We're regularly now receiving 2 of those vaccines into North Yorkshire, the Pfizer-BioNTech vaccine and the AstraZeneca vaccine, and we're expecting the Moderna vaccine in the spring. There are 3 types of vaccination sites that we're operationalising in North Yorkshire to deliver the vaccine for you, for members of the public. There's local vaccination centres, which is where groups of GP practices come together, and we've got a really good spread of those across the county, and I do just want to take a minute to go through those for you so you know where they all are. So they're in Leyburn, Northallerton, Harrogate, Whitby, Filey, Scarborough, Malton, Pickering, Tadcaster and Selby. Those are in North Yorkshire. And then in York, there's the Haxby Group Practice and the PCN site at Askenbar. So a number of sites across the county. We've also got the hospital hubs operating, and they're focusing on delivering vaccination to our health and care staff. And then on Monday, I'm pleased to say that the large-scale vaccination site for this area opened, and that is also on the Askenbar site on a different part of the site in York, and that's available to the wider community. We are making really, really good progress in North Yorkshire. As of Monday, there were nearly 4.2 million people vaccinated across the country, and in North Eastern Yorkshire, over 700,000 doses of vaccine have been given. And we hope very soon to be able to give even more detailed information about how we're doing locally. But at the moment, we're focusing on offering vaccinations to those in the top 4 cohorts that were identified by the Joint Committee for Vaccination and Immunisation. And those are everyone over the age of 70, care home residents and their carers, health and care workers, and the clinically extremely vulnerable. We are on course, I'm really pleased to say, to offer vaccinations to all care homes residents and their staff by the date of Sunday, which was the target that we were set. So as soon as we do get any more information in terms of the numbers, we will be sharing those with you. So the NHS is leading the vaccination programme, but we've got great support from all of our partners, and actually I'm really delighted and proud to say huge support from many volunteers across the county who are working with clinical staff, nursing staff to deliver the vaccine to our population. But what I would say is I know everyone is really keen to get the vaccine, but the NHS will call you. We will call you in turn and invite you to have your vaccination. And we do expect that everyone in those top 4 cohorts will be invited for a vaccine by the 15th of February. So please do be patient. We're working incredibly hard and as quickly as we can to get the vaccine out to you. And I can assure you that nobody will miss out in North Yorkshire and York. Thank you.
Thank you very much indeed for that, Amanda. So finally, just to complete the scene setting for us all, I'd just like to invite Chief Inspector Charlotte Bloxham to give a picture of current policing response to the pandemic here in North Yorkshire.
Thank you, Maeve. Good evening, everyone. So I'm Charlotte Bloxham, and I'm responsible for the policing response to the pandemic across North Yorkshire and the City of York. I'll be able to give you some facts and figures around the number of fixed penalty notices that we've issued, particularly recently in the most recent lockdown, and in total across the whole of the pandemic. I'll also be able to give you some information, hopefully, around some of your questions in relation to the guidance, which at times can be confusing. So hopefully we can get some clarity around that this evening. So just to set the scene, and I'm sure you're all more than well aware of this, as it's on the news all the time, isn't it, around the number of deaths that have sadly occurred over the country. So I think it's been announced today that in the last 24 hours, the UK has recorded the highest number of deaths in a day since the start of this pandemic, and that takes the number of deaths which are linked to a positive COVID test to over 90,000, which I'm sure you'll agree is very alarming and shocking numbers. So from a policing perspective, it's really important for us that we can do our bit to make sure that people are adhering to the guidance and that they recognise that the guidance is there to protect you, to protect your families, to protect your loved ones, and to protect those vulnerable people within our communities. So I would ask you to think about all of those families of those 90,000 people who have died, and the mums, dads, sisters, brothers, husbands, wives and children that they've left behind. And for those people who see on a daily basis people blatantly flouting the lockdown rules, just imagine how they must feel about that when they're going through such an incredibly painful time. So in relation to the fixed penalty notices themselves, we do have a staged approach in terms of engaging with the public. Obviously at the start of the pandemic, it was all very new to people, and it was really important that we took the time to engage with people and explain what the legislation and the regulations were. And they do change as the months have gone on. They have changed, haven't they? So it's still really important that we do ensure that people understand them and encourage people to abide by them. However, sadly to say that there are a minority of people that continue to flout the regulations, and in those cases we will enforce them by the issue of a fixed penalty notices. And I can update you that in the last week alone we've issued 134 fixed penalty notices across York and North Yorkshire. And in total, since the start of this particular lockdown at the beginning of January, we've issued a total of 241, and I can provide the breakdown of those fixed penalty notices per district as follows. So this is for the last 7 days. So in the Craven district, we've issued 7 notices, in Hambleton 19, in Harrogate 12, in the Richmondshire district 1, and likewise 1 in the Rydale district, in Scarborough 57 notices, in Selby 9, and in York 28. So I think it's fair to say that many people do understand the seriousness of the situation and are staying at home and saving lives, and I thank those people for continuing to make those daily sacrifices and protect the most vulnerable among us. It is really difficult, I understand that. However, there is a stubborn minority who don't believe the rules apply to them and don't understand the risk that they pose to themselves and the wider community, and that's why when we encounter these individuals we will take enforcement action against them. Thank you, Maeve.
Thank you very much indeed for that, Charlotte. So just a brief reminder on how to ask questions. The instructions are just up on your screen again. And just to remind you, your question will be reviewed before being posted for everyone in the session to see in the question bar. So please ensure you don't provide personal details if you don't want other people to be able to view those. So we need to get going, don't we? We have until 8:30. To get through just as many possible questions as we can. Hopefully in the summaries that Richard and Amanda and Charlotte gave you, there's a little bit of clarification for you if you did, if your questions related to some of those specifics. So I'm going to pose the first question to Richard. And this question, Richard, has come in from Ruth. And I'm an unpaid carer for my daughter who has complex needs and requires 24-hour care for input and interaction. The lack of input and interaction during lockdown is hampering her mental and physical health, and Ruth's obviously very concerned about seeing her daughter regress. So when are support groups for vulnerable adults and those with additional needs likely to be able to operate again in some form? For many of the voluntary-led groups and others who wish to run it, finding premises that have COVID protocols in place is very hindering. So are there any council properties available that groups like this could actually tap into?
Okay, thank you. And thank you, Ruth, for that question, and also for your good ideas throughout the pandemic, and for keeping me right on a number of issues too. That is appreciated, and for being a really strong voice for family carers too. We are operating some support groups and in fact day services for people with disabilities and for older people. That is assessed on a case-by-case basis, and we work with providers and support groups to see how they can do that in a COVID secure and safe way. And that does involve a range of different premises around the county. Now, I know particularly you're interested in the Craven area, and we will be working with both our providers in that area and also our Stronger Communities team to look at how we can find suitably accessible venues. So we are on it. We have opened up some services across the county. Obviously, they've had to be more limited because of social distancing, and in some cases we've had to ask the staff to give other support to other services, for example, for people coming out of hospital. But I do recognise what you're saying, and we are doing our best to try and provide some support groups and some day services. I should say we also very clearly made the decision that even with lockdown, that this support was vital for people, and we've tried to keep as much going as possible.
Thank you for that, Richard. So I've got a question for Amanda here, and it's a question in from Rebecca, but I think it applies to quite a number of the questions that we've had in. So Rebecca is asking whether everyone in her household would be vaccinated at the same time. They've got a vulnerable child, adult child, who is shielding, physically and learning disabled. The parents are both carers. What is the position with households being vaccinated if one person in the household is called for vaccination?
Yes, thank you, Rebecca, for that question. It's really timely actually, because there's been some latest guidance published, and that's now really clear that we need to take a pragmatic approach. So if this means that if a partner or family members of an individual who's called for vaccination, that the practices can vaccinate all members of a family at the same time, if it's safe and appropriate to do so. But I think that gives a lot of flexibility to you and your family and to other families in similar situations to make one trip as a family to get vaccinated. So hopefully that's welcome news. Thank you.
Thank you for that, Amanda. I hope that is very welcome news. Thank you for that. So we have a couple of questions in around support bubbles, so I'll maybe direct this to Charlotte, if that's acceptable. So a couple of questions just throw in, if you could maybe just wrap them up into how do support bubbles work. So is your support bubble okay if it's over half an hour's drive away? Can I have multiple childcare bubbles, which include my babysitter sleeping over? And just to confirm, so I have a support bubble with my daughter, and her partner is bubbling up with his mum. We've just realised we're linking 3 households. Is that too many? Are we getting this wrong? So a little bit of confusion around support bubbles. Richard, do you feel more comfortable taking that one initially, or Charlotte?
I'm happy to kick off, Charlotte, unless you want to kick off with that.
Be my guest, Richard.
Okay, so the first thing I'd ask you to do is, if you've got access to either a smartphone or a computer, go on the gov.uk website, or you can go actually on the North Yorkshire County Council website, and you can check the latest guidance. If you Google national lockdown, stay home, that will give you all the details, and there's a section both on childcare bubbles and on support bubbles. So just to talk briefly about those. So childcare bubbles apply where you're a household with anyone aged under 14. You can form a childcare bubble, and you have to form that bubble with another household, just one other household. It has to be one other household only. You can change your childcare bubble, so you can move arrangements, and you have to keep a 10-day gap if you move your childcare bubble, so between the old arrangement and the new arrangement. If your parent's sharing the care of a child, that child can travel between the 2 different homes. You can have a support bubble and a childcare bubble. So a support bubble is slightly different. A support bubble particularly works with someone who's perhaps on their own, has care needs. You might be providing informal support, family support to that person. You can form a bubble with them as a support bubble. and you can have a support bubble and a childcare bubble. Important things to remember though, you mustn't mix your support bubble and your childcare bubble. And where you have a childcare bubble, that's not a social, it's not for socialising. It's purely for childcare. So it's not an opportunity to catch up with the grandkids or any other kind of thing that might be a really nice thing to do. Unfortunately, it's purely for childcare. You can't actually have multiple childcare bubbles. So that question about the babysitter and a number of childcare bubbles, that's not allowed. You've got to have one childcare bubble. And the same goes to support bubbles. You are effectively forming a single household with someone else in your support bubble. So I know it's really difficult, but that's unfortunately that's the situation that you've got to deal with. The question that came in about actually your daughter's in one support bubble and her partner is in another, then that is really difficult, and each family has to work that through. But my expectation is that you would form one support bubble with one other family household. So in that situation, I would expect your daughter and her partner to potentially be the support bubble with you, and then unfortunately her partner's parents might have to form a support bubble with someone else. That's really difficult, but actually those are the kind of unfortunate choices that we're all having to make at the moment. So that's the best advice I could offer, really. Please though, read the detailed guidance on the website, if that would help.
Thank you for that, Richard. Charlotte, would you like to add anything to that?
I don't think there's anything. I think that was covered really well there by Richard. All of these details are on the gov.uk website though, and it is really clear, easy to read guidance. So I would encourage anybody who's confused just to refer to that guidance, because it is really useful.
If I could maybe just add a follow-up question about bubbles to yourself, Charlotte, because it does relate to someone being anxious about receiving a fixed penalty notice. If their bubble is an hour away, is that acceptable?
What I would say in relation to that is, wherever possible, I would encourage people, if they do need to form a support bubble, to do that as close to home as they can do. But I appreciate everybody's got different circumstances, haven't they? And if family members or people who they would naturally bubble with do live some distance away, then there is no limit on the amount of travel that you can take to form that bubble. But just being mindful of the fact that you may be spreading the virus from a potentially highly infectious area to a less infectious area, and travelling through other areas to do so. So my advice would be, wherever possible, bubble with people as local as you can do, but appreciating that people do need the support, which is the whole point of the support bubbles in the first place. So if it's unavoidable and that's the only bubble that you can make, then that's the way it is, and there will be no enforcement action in relation to that.
Thank you for that.
Could I just come in, Maeve, just something to say? I think generally on some of the answers we're going to give tonight, the whole point of this is to be cautious. It is stay home. The guidance, it is a lockdown and it's called stay home for a very good reason. So if you're having questions and doubts, then my advice is to always err on the side of caution. It's just as Charlotte said, you don't want to be spreading the infection. You don't want to be increasing the risk to yourself or others. This is not about an exercise in exposing the loopholes. It's about keeping safe, reducing travel, reducing social contact. So if you've got a doubt, if you're asking in your own mind, can I really do that? Then the answer is probably no.
Thank you, Richard. So let me just pose another question to Amanda. So this is in from Dennis, who asked when and where he could expect the second dose of his vaccine. He had a Pfizer jab. He received his first dose, but he's just not sure when he's likely to be called for his second dose. And he's got some question just about the efficacy, just how effective the Pfizer vaccine is.
Yes, thank you. And thanks for the question about the second dose. I'm sure a number of people will be interested to know how that process is going to work. So the second dose, as for whichever kind of vaccine you receive are going to be given 12 weeks after the first dose, and you'll be contacted either through your primary care site or through the large scale vaccination site, and they will contact you. You don't need to worry about when it is. It's a really interesting question about long-term efficacy, and we're obviously just rolling out the vaccines now, but each of the three goes through very, very detailed clinical trial process and rigorous assessment by the MHRA, the Medicines and Healthcare Products Regulatory Authority. And I know that extensive data is being collected on the long-term efficacy of all of the vaccines.
Thank you, Amanda. So I've just got a quick question for Charlotte. Charlotte, what happens to the fixed penalty notice monies, the monies that are collected from fixed penalty notices?
So as I understand it, that's a very good question. Maybe caught me out there. As I understand it, the monies are fed back into local authorities and are utilised, obviously, in a way that can support the response to COVID, which is clearly has been an ongoing and long event, which we will be stuck with for a while now, we think. So the money there is really to support the effort towards the COVID from the local authorities.
Thank you for that. So a question for Richard. Because they said at the beginning you were up for answering questions about schools, Richard. Should North Yorkshire County Council and the NHS be doing more to reduce numbers in schools? Many are very overcrowded, have poor ventilation. Is this being taken seriously?
I can say absolutely it's been taken seriously. It's been taken seriously on several counts, really. It's been taken seriously in terms of the welfare of children and teachers, and working with all of the staff in schools to keep people as safe and well and protected as possible. It's also being taken very seriously on the importance of children having the opportunity to learn. And we know that there are big disadvantages potentially to children of not being able to go to school and not being able to learn. And we also know that actually for parents, it's really important for them to be able to do, whether they're working from home, whether they've got to go into their workplace, to have support from schools for their children too. So right since the beginning of the pandemic, we've been providing a lot of advice and support to schools, working with head teachers and their staff to try and keep them as safe as possible. We've always followed the guidance that's been issued nationally. During several of the previous spikes in the pandemic, we have managed to keep many schools open and supporting people, and I'm pleased that we've been able to do that. Currently, obviously, the guidance is around focusing on the children of critical workers, and also on vulnerable children who may struggle to learn from home for a various number of reasons. We would say, I think the advice from schools colleagues would be that we all need to be a bit circumspect about that. So it isn't a free-for-all for everyone. We would say that, yeah, by all means, the schools are open for those groups of people, but actually, please only use them if it's absolutely essential for you to do so, for you and your child to do so. And that way we will keep the numbers down and we'll be able to protect people and keep them safe. We obviously are giving public health advice all the time about how schools can operate safely. If there are specific concerns then around a particular school, what I'd urge the questioner to do is to drop a further question into the email box, and we can follow that up with individual details.
So thank you for that, Richard. So just a follow-up question, just staying with schools, the possibility of vaccine for school teachers to help keep schools open, is that on the agenda at all in North Yorkshire?
So I might want to hand over to Amanda in a minute, but if I just kick off, I mean, there are very clear rules that have been agreed and set nationally about the priority groups for the vaccination, and as you've heard, the NHS is making great progress in vaccinating as many people as possible. In due course, we will all receive the vaccination, but unfortunately, it will take a little bit of time to get there. There are lots of people currently saying, "Can we have a priority for the vaccination?" The police, quite rightly, undertakers, teachers, and others. And unfortunately, it will take a bit of time to get there. I don't know if Amanda wants to comment in a bit more detail on that.
I'm happy to comment on that. Thank you, Richard. Maeve, can you just confirm for me what in terms of the priority, what was the specific ask of the question?
Just was vaccination for school teachers being considered to help keep schools open? Thank you.
Yes. So I haven't heard that there's been any change to the prioritisation. The way that the prioritisation has been worked out is based on age is the biggest risk factor for COVID, and so the Joint Committee considered risk factors predominantly based on age. But we know that there are a number of professions who, simply by the role that they're doing, puts them more at risk of coming into contact with individuals with COVID. And as Richard said, that's colleagues in the police, colleagues in the in fire and rescue, our teachers, delivery drivers, etc. I think it is being looked at, and I think it's a very good question. I think that what we need to focus on is getting through the top 4 cohorts as quickly as we can by the 15th of February, and then rolling out through the rest of the age bands down to band 11. And then the sooner we can do that, the sooner we can get everybody vaccinated.
Thank you. Amanda, if I could just stick with you for a follow-up question. Do I have to have the first and second doses of the vaccine at the same venue? Do I have an option of choosing which venue I can have a vaccination at?
Okay, so I think there's two slightly different questions there. So in terms of the first and second vaccine, it is recommended that you have them at the same site. I don't think it's necessarily 100% that you have to, but for the process in terms of being recalled for your second appointment, it makes sense. But in terms of choosing where to go, there is the chance that you may get 2 invitations for a vaccine, either through your local vaccination site, the primary care vaccination sites, and also through the large-scale vaccination sites. And if you do that, then you can make a decision about which one you would rather go to. And then in terms of accessing the second vaccination, what we would recommend is that you then go to the same place for the second one. So I hope that covers that.
Thank you very much indeed for that. So a question, I'm not sure if it's Richard or Amanda for this one. So it's about reasonable adjustments that could be made when someone goes for their injection. So this is Natasha in Harrogate, who says that she has underlying medical condition that's associated with autism, dyslexia, dyspraxia. She is concerned about going for her injection. She's concerned that her invitation will come by text, and that isn't easy to read information for her, and that reasonable adjustments would be made when she goes for the injection. She struggles with injections, and she struggles with crowded rooms, and will it be possible for her to have someone with her, and will it be a safe place for her to be, because she's feeling vulnerable?
I'm happy to pick up that question, Maeve.
Thank you, Amanda.
Thank you, and thank you for the question. I understand for a number of people, actually, the thought of going for a vaccination will be quite a frightening experience. There's not many people I know who do like needles, and we will try wherever possible to make the experiences as sort of painless as possible, in terms of supporting each and every one of our communities to access safely the whichever site they go to for the vaccine. Everything possible will be done to make sure that we can support people to get their vaccine. What I would say, without knowing any real details, is that your practice will have details of your needs and requirements, and I would suggest that you discuss it with them when you're contacted. It's more than likely that you would get a letter or a telephone call rather than a text message to book your appointment, and you should be able to discuss your needs then when you book that appointment. So hopefully we can make it a process that is very accessible for you. And in terms of having somebody with you, that's absolutely appropriate as well. Obviously, you need to wear a face covering, etc., but that will be acceptable too.
Thank you for that, Amanda. Richard, did you want to add anything to that?
No, the only thing I was going to say, and again, like Amanda, I don't know the individual circumstances, but if you live in supported housing, or if you have support from a volunteer group, or you have a social worker, for instance, and you get support from the county council, then equally we may be able to help you. It's worth checking that out too. But absolutely reinforce what Amanda said.
Thank you for that, Richard. Richard, just staying with you, a question for someone who's saying, I'm shielding again. Is North Yorkshire County Council going to start delivering food parcels?
Yes, shielding arrangements are in place once again, but we haven't got arrangements currently around food parcels. That was part of the first wave of the pandemic, and the arrangements have changed nationally. That was part of a national programme. But there are a number of ways in which we're able to help through. We've got a network of 23 community support hubs, and they are supporting people in towns and villages right across North Yorkshire. We also have some help available if people are struggling with funding for food. We've got a number of initiatives. Again, your local community support hub should be able to offer. If you go on the County Council's website and look under the details on the coronavirus, there is more information there available to help people. Equally, if you're not sure what's available and you want to phone someone and get some advice, then we have a customer centre. The number is 01609 780 780. It's open 7 days a week, 8 AM to 5:30 PM. The other thing I would say is just for families, we have arrangements in place either with schools for either vouchers or hampers, and if you've got an issue, if you're a family, please talk to your children's school about that. So yes, there are arrangements in place, but they're different from the arrangements in the first wave of the pandemic.
Thank you very much indeed for that, Richard. Richard, the number tripped off your tongue there. Do you want to just say the phone number again? I think it was 01609.
Yeah, so it's 01609 780 780, 7 days a week, 8 AM to 5:30 PM. You can also go on our website. I think the right address is www.northyorks.gov.uk/COVID help.
Thank you very much indeed for that. So a couple of questions about the rules, the guidelines for Charlotte. Let me just reinterpret. I'm a recreational fisherman, and that activity has been allowed through lockdown. So my question is, what is classed as local travel, as my nearest pond is 5 or 6 miles away, but the nearest bait shop is 20 miles away?
Thank you. That's an excellent question. So in relation to travelling for exercise then, it's really clear that the message is to stay local in order to do that. You can exercise once a day, you can exercise with one other person from another household, but the guidance is very clear that people need to stay local, and that's for the reasons that we've outlined earlier on around reducing the spread of the virus as much as we can. So local is defined as within your village, your town, your city or locality. So probably in those circumstances, I would say the bait shop's probably a bit far out. And we'll probably have to look at if that's your chosen form of exercise, whether in these exceptional times you need to consider looking at either other forms of exercise or alternative methods of being able to conduct that exercise just for the duration of this national lockdown. It is here and it's with us for very, very good reasons, and that's for the health of our families and our communities. We're not trying to be the fun police and spoil people's activities, appreciating this has gone on for a really long time now, but it is for a really important reason, and that's to protect people and to protect the NHS. So yeah, the message is really stay local, stay within your locality and exercise from your doorstep.
Thank you for that, Charlotte. And again, another question about exercise. Apologies if you're going to repeat the message again, or no apologies if we need to repeat the message again. For cyclists, there's a lot of questions in from cyclists about, you know, what is a reasonable distance, 20 miles is nothing to, a good cyclist, 15 to 30 miles. Is it acceptable to travel 15 to 30 miles to a forest to be able to ride a bike?
So in relation to that one then, if you are travelling in a car, 30 minutes in a car, excuse me, if you are travelling 30 minutes in a car to then get out and get your bike out of the car to take your exercise, then I would say that that's not acceptable. That's not staying local. You can easily obviously exercise on a bike from your own home. And it may be that it's a different locality than you're used to in terms of taking that exercise, but in terms of travelling those kind of distances in order to take exercise, then I'd say that no, that's not acceptable.
Thank you for that, Charlotte. Amanda, as you were doing your introduction, you listed all the local centres, all the hubs. Where can people go to actually find that information? Because I have some questions in about, can I choose and where could I go to actually get injected?
Yes, thanks. Thanks, Maeve. So there's quite a long list that I read out, and we can they are available on the website, and we can put the website details in the chat box or share that out with members of the public on this call. All of our GP practices across North Yorkshire and York are involved in the local vaccination centres, and when the vaccine was rolled out back in December, we were asked to get those practices to work together, because what we wanted to do was to deliver the vaccine at scale. And as you'll probably know, the Pfizer vaccine particularly is a frozen vaccine, so is less able to move it between sites, and we wanted to make sure we didn't waste any of the vaccine. So we believe that most people, the vast majority of people in North Yorkshire and York, are registered with a GP practice, so they will have your details and they will call you when it's your time as per the prioritisation criteria for your vaccination. There is now the option of both the mass vaccination site in York that I've talked about at Askham Bar, and there are other sites coming on stream. So we anticipate that there will be some community pharmacy sites coming on stream, and there may be other local vaccination sites coming on stream. So, for example, we're opening a site in Ripon in the next week or so. Members of the public won't be able to choose which local vaccination site they go to, because that is linked to your GP practice. However, you can choose, if you get an invite letter, to go to either the large scale site. But if you don't want to do that, if it's not convenient to travel into York, you can wait, and the letter does clearly say you can wait for your local GP practice to contact you. And the timescale for the top four cohorts is by the 15th of February, and then once we achieve that, we'll then be able to understand how long it's going to take us to get through the remaining cohorts. So hopefully in the next 2 to 3 weeks, that's the 15th of February, isn't it? We'll then be able to be clearer with members of the public the sort of anticipated rollout time for the future cohorts. So that's quite a lengthy way of answering that question, but hopefully it covers all the points. Thank you.
Thank you, Amanda. Amanda, if I could just stay with you for the next question. Because I am clinically extremely vulnerable, I've been working at home since the first lockdown. I'm employed by North Yorkshire County Council in a school. After my first vaccination, will I be expected to return to work? Do people take up their normal routines, even if they're extremely vulnerable, once they've had the first jab? So
that's a really good question. And what I will do is tell you what I know in relation to the vaccine, but I suspect that the individual employers will have specific policies on that in terms of individuals' vulnerability. So what we're really clear about is that 2 to 3 weeks after the first vaccination, you get immunity to COVID. What we've really been clear with everyone, though, is that having the vaccination does not mean that you will never get COVID. What it does mean is if you were unlucky enough to get COVID, you will not be as seriously ill as you would have been had you not had the vaccine. So you are still potentially at a smaller risk of getting an infection. And then obviously full immunity is imparted when the second dose it takes place at 12 weeks. So what I would be suggesting is that the individual contact their employer, because all employers, once the vaccine programme is rolled out, will be starting to understand what their shielding policies are for those individuals and members of staff who've had the vaccine whilst COVID's still circulating in our communities.
Thank you very much indeed for that, Amanda. So a question for Richard, I think. What are the options for parents who want to home educate their children temporarily if cases start to rise again in schools? The new variant is clearly much more infectious than the original one. And if both parents catch the virus, is there a plan of action for childcare?
So obviously there are already arrangements. People can choose to home educate their children anyway at any stage in their children's education, even without the pandemic. What we're saying at the moment in terms of home versus going to school is that the focus of schools at the moment is on children of critical workers, where it's absolutely essential, where there are no other arrangements in place, or for vulnerable children who, for whatever reason, can't learn online or learn at home and need to go into school for their own well-being or for other reasons. Obviously, there will be situations where lots of parents will have the situation where one or both of them may well have COVID, and I would ask all parents to think about their childcare arrangements in those situations, really. So people do need to think ahead, and the guidance does outline some of those issues. So again, if you check out gov.uk and look at the specific recommendations and advice for your household circumstances.
Thank you very much indeed for that. And another couple of questions about travel and distance, acceptable distances to travel. My child lives 150 miles away. Can I travel overnight and stay overnight in a hotel to see them? Or another one, my youngest son lives in Greater Manchester. I work for the health service. Am I allowed to travel to visit him? I'm worried about breaking COVID rules, but I'm very lonely as I live by myself. Charlotte, again, just to yourself, just about those distances that are acceptable for people to travel.
And it's really difficult, isn't it? It's really difficult, and some people live in circumstances that make that even more so. I would just re-emphasise the point that I made earlier, that the guidance is, and what we want people to do is to stay local, not travel many miles unless they need to do so. But this also links into the overview that Richard gave earlier on around support bubbles, of course, and they are really key to many members of our communities in terms of their health and well-being. So what I would say is that if you refer to the definition of a support bubble, as Richard gave earlier, and is accessible on the gov.uk website, if you believe that you fall within those criteria and you are unable to find a support bubble at a closer distance, then it may be that in exceptional circumstances that some of those distances are okay. However, I would caveat that with something that I mentioned earlier around spreading the virus. These guidelines are here to protect people, and we need to minimise the spread of the virus as much as we can, because the sooner that we do that, the sooner we can all return to normality. And we may have to live through some really difficult times, and many people miss their families, don't they? And I understand that, but we are really in exceptional times now, and people just need to think about that. Ask yourself the question, does it feel right? And if it doesn't feel right, then as Richard said earlier, it probably isn't.
Thank you, Charlotte. It is we're getting lots of questions in about those distances that people want to justify in their own minds that they can travel, and it is very difficult for people, especially just that question. I'm lonely, I live by myself, so it is really hard for individuals. So Amanda, I have a question for you. It's from an individual who believes they're in cohort 6. Not sure when they'll be contacted for a vaccination. It's making them quite anxious because there seems to be a disparity between They're under the advice of a consultant at the hospital who is classifying them as chronically extremely vulnerable, but their GP doesn't seem to have that on record, doesn't seem to be aware of the medication they're on. Will they fall through the initial invitation for Group 6?
Thank you. Yeah, thank you, and thank you for the question. And I think that I have seen the detail of the question, and I understand your concern. So I just want to pick up a point that's in the question, which is around flu vaccination. So just to point out that the flu vaccination is free on the NHS now to anyone over the age of 50, and you can access that through your community pharmacy. You don't need to be called for it, and you can just go to a local pharmacy offering that service and book on. In terms of the cohort 6 priority, so cohort 6 are those people with an underlying health condition that makes them more vulnerable from the effects of COVID. So obviously the government guidance is that we vaccinate the top 4 cohorts by the 15th of February, and then we'll be working through the remaining cohorts. So I think fairly quickly we'll be coming on to that cohort 6, those with underlying health conditions, and you will be contacted either through your GP practice, because you will be recognised in that cohort, or through the large scale site, which is through a national letter. So I wouldn't worry about that. It's clear that you're in cohort 6, and I think that practice will understand and know that detail. And as I say, if you still want to have a flu vaccination, then hopefully you'll be able to do that as well. Thank you.
Thank you very much indeed for that, Amanda. We are pretty pressed for time. We're very conscious of the number of questions that have come in, and I will just wrap up at the end and explain what will happen to them. But just before we finish this evening, just to give our panellists just an opportunity for a last word to us. Richard, is there anything that you would like to say just as we sign off for the evening?
So I want to start by thanking everybody across North Yorkshire for all you've done over the past year. We can get this virus tackled and get these infection rates down. Please stay home, protect the NHS and care services, and save lives. Thank you.
Thank you, Richard. Amanda.
Yes, thank you, and thank you for the opportunity to answer the questions and for all the great questions. From my perspective, 2 things. On behalf of my wider NHS colleagues, please do stay at home and protect the NHS. But from a vaccination perspective, the NHS is rolling out this vaccination programme as quickly and as safely as the supply of vaccine allows, and we're making great progress. You will all be called for a vaccination by the NHS in line with the priority criteria set out, and I know everybody wants that as soon as possible, and please bear with us. We are working as quickly as we can. Thank you to all the volunteers who are working with our teams to do that, and we will be contacting you. Stay safe until that time. Thank you.
Thank you, Amanda. And finally, Charlotte.
Yeah, thank you, Maeve. I'd just like to say, I guess, a thank you to the vast majority of the public across North Yorkshire and the City of York who have adhered to the guidelines that have changed so rapidly and so quickly over the last sort of 10-11 months. I appreciate this. That's been really challenging for people to adapt to understand and to modify the behaviour with. And I also appreciate that it's difficult staying at home as much as you have to. My other plea would be to the people that choose not to adhere to those rules, just to say, please think about your behaviour. We're really reliant on people to have some personal responsibility around some of this, because at the end of the day, when you're flouting the regulations, then you are spreading the virus, which puts the NHS under even more pressure. It puts our vulnerable people at risk of becoming infected, and it means that our return to normality may not arrive as soon as we want it to. So a massive thank you to the vast majority, but for those that choose not to adhere to the regulations, then unfortunately then we will enforce them going forward. Thank you.
Thank you, Charlotte. So just a final thank you to you all for joining us for the Q&A session this evening. We've had just short of 90 people online asking questions in addition to the questions we had in beforehand. So just to remind you that we will be answering all of the questions that have been submitted online or this evening, and posting the Q&As up onto the City Council, or the County Council website, apologies, the County Council website for you to access, along with a recording of the session this evening. So if you want to leave any feedback in the chat bar just before you leave, that would be greatly appreciated, just so that we know if this was of value to you, if you would like to see another session like this again. So any feedback would be appreciated just before you disappear. But thank you again, and stay safe and good night. Thank you.